lactation consultant today, Alona. So today, I'm going to address one of you, my subscribers, na nag-message sa akin about some concerns with breastfeeding, okay? Ito'y naranasan ko sa aming breastfeeding clinic before. Itong situation na to, nagkakaroon ng complication si Mommy, okay? Si Mommy ay nagkakaroon ng complication and she has to take antibiotic. Ang sabi ng doktor sa kanya, you need to stop breastfeeding for 2 weeks because the doctor was saying the medication that she's using is contraindicated to breastfeeding. So, i-explain ko sa inyo mga nanay kung bakit nangyayari ang mga situation na to. And I know it is so frustrating for so many moms na na-encounter ko sa aming breastfeeding clinic. Some of them umiiyak, nangihinayang, galit galit sila sa desisyon ng doktor nila. Galit sila, nagigilty din, they feel very guilty na hindi nila mapa-breastfeed si baby for 2 weeks. At galit sila na parang hindi naririnig yung side nila with their pediatrician or with their doctor. Ang galit sila dahil they cannot decide on their own on what they can do with this while breastfeeding is not allowed. So, explain ko sa inyo, ano ba talagang gagawin? Anong gagawin nyo kung let's say buntis ka ngayon? Or let's say kapapanganak mo lang? Or there comes a time na nagkakaroon ng situation at sasabihin ng doktor, you need to stop breastfeeding because you're taking this medication. So, kami mga lactation consultant, wala kaming right. Kahit ako'y nurse, kahit ako'y lactation consultant, I have no right to contradict kung anong sasabihin ng doktor. No, because they're doctors. And I'm a nurse and I'm a lactation consultant. Hindi ko role yan. Now, when it comes to counseling, when it comes to explanation about what's gonna happen if the baby gonna breastfeed. So, based on our study as a lactation consultant, we studied most of the medications na tinitake ng mga moms while they're pregnant or after they gave birth or while they're breastfeeding. Okay. Halos lahat, halos siguro ito nilang gamitin kong word, okay? Most of the antibiotic are safe with breastfeeding. However, again, sinasabi ko sa inyo, I am not a doctor. It's the doctor who will tell you if that is safe for the baby. Now, based on the studies that I studied, normally, sa mga medication na tinitake natin, let's say for example, medication sakit ng ulo, medication for for pain na nabibili nyo lang over the counter, yung mga medication na yun, for breastfeeding moms, inaalaw yun ng mga doktor na they can take these medications if they have headache, if they are having some pain, na yung mga medication na yun over the counter na yun. When it comes to antibiotic, may mga doktor talaga, I've encountered this one many times, may mga doktor talaga na sasabihin, no, you have to quit breastfeeding for 2 weeks, or you can pump and dump for 2 weeks, dahil yung medication na tinitake mo is not safe for the baby. May iba naman mga doktor na they agreed, okay mom, you can take that medication, and you can still breastfeed. So, iba't iba ang prinsipyo ng mga doktor. And again, I've said this before, hindi lahat po ng doktor or pediatricians nyo ay lactation consultant. Hindi. So, what I studied for 3 years or 2 to 3 years na lactation consultant, minsan yung mga ibang doktor, konti lang yung kaalaman nila about doon sa breastfeeding, doon sa mangyayari, because again, it's not their field. However, minsan, there were times na minsan may nakikipag-discussion ako sa mga doktor when it comes to breastfeeding. Kasi kalimitan minsan hindi din naiisip din yung mga doktor kung anong mangyayari dito sa milk supply ng mom pag hindi nila tinuturuan kung anong gagawin while they're saying don't breastfeed. Kasi natatakot na si mom dahil sabi ng doktor, it's contraindicated with breastfeeding, baka may mangyayari si baby. So again, you need to, pag itong sinasabi sa mga pediatrician, you need to tanong, you need to ask question. You need to ask question more. Kasi pag oo lang kayo ng oo, at hindi kayo nagreklamo, pagdating nyo sa bahay, nai-stress kayo, hindi nyo malaman kung anong gagawin, the baby is crying for you to, for the milk, for the breast milk. The baby is dying to breastfeed. However, you're feeling kind of, naguguluhan kayo. So you need to ask questions. Don't be afraid to ask questions pag itong sinasabi niyo mo doktor sa inyo. So when this mom come to our breastfeeding clinic, umiiyak sa akin, sasabihin Alona, and there were moms in my experience that they refused to stop breastfeeding. They said, I am not stopping breastfeeding. I'm gonna continue breastfeeding. At the same time, I'm gonna take that medication, but I will tell my doctor. And when they do that, I always tell them, make sure you tell this to your doctor, okay? Alam niyo ba kung bakit? If there's such complications, kung may mga mangyayari man o mga concerns, at least alam ng doktor niyo kung anong desisyon niyo. And everything you do as a mother, alam mo kung anong ginagawa mo. And I know that you cared for your baby. You have to weigh things before you make decisions, and it's always good to consult the healthcare provider that you can trust. If you feel like na yung doktor nyo ay you don't feel like you feel welcome o natatakot kayo magtanong o yung doktor nyo minsan walang time mag-explain sa inyo, bilis-bilisan dahil ang daming pasyenteng they're doing like the numbers of patients that they have every day. Kung wala silang time that they sit in front of you and explain to you this dahil nagmamadali, then you may find other doctors na you feel more comfortable. Dahil mahirap sa mga parents, sa mga nanay na nagbe-breastfeed na walang guidance. Pumupunta nga kayo sa mga doktor nyo, sa mga healthcare providers nyo to get advice, to get guidance, tapos minamadali kayo. Hindi ini-entertain yung mga tanong nyo, or you feel so scared to ask question or to contradict kung ano man sasabihin ng doktor. It's okay. It's okay to voice out whatever you feel. Kailangang i-open nyo kung ano yung mga concerns nyo sa mga doktor nyo. Dahil itong mga doktor din ninyo, kung hindi rin kayo mag-voice out, sige lang sila na sige kung ano yung gagawin nila para sa baby nyo. So, if you feel like sabihin nyo, Doc, parang hindi ko kayang gano'n na 2 weeks na hindi ako mag-breastfeed. Is there any way I can do what I can do? So, gano'n ang gagawin nyo. May isa akong mga nanay, i-explain ko to sa inyo, okay? Not isa. There were a few in my mga pasyente ko na some nanays nagtitake ng medication para sa high blood, okay? Other nanay nagtitake ng medication para sa depression. So, itong mga gamot na to, there's slight side effect talaga, contraindicated side effect doon sa breast milk because some of the components of this medication would really pass through your milk. And one thing too, pag nagtitake kayo ng high blood pressure medication para sa high blood nyo or sa hypertension, if you take the amount or the dose na minsan nakaka-affect sa baby, minsan bumababa din yung blood pressure ni baby. If it pass through your milk, the more if there's more amount of particles, components in that medication will pass through your milk, minomonitor din namin yung baby kung bumababa din ba ang blood pressure. Because of course, it can pass through your mouth. However, may mga technique kami as a lactation consultant on how to prevent this kind of reactions or side effects. There were times that we discuss with the doctor and we recommend if the mom can take the medication after you breastfeed. So you wait. So let's say nag-breastfeed ka ngayon, then due mo na in and out to take your medication para either sa infection or either sa hypertension, etc. So after you breastfeed, you take that medication right away. So it may take another 3 hours bago ka na naman mag-breastfeed ulit. So yung component ng molecules ng gamot na iniinom nyo, hindi masyadong madami o it's lesser amount that it pass through your mouth pag lumampas na yung 3 oras or 4 na oras. Iyon din ang ibang strategy na ginagawa ng mga healthcare provider. However, sa mga doktor na walang kaalaman masyado about lactation consultation or how these particles of the molecules of this medication pass through your mouth, then maybe sasabihin ng doktor, hindi ka talaga pwedeng mag-breastfeed. So again, you need to weigh things. Timbangin nyo ng timbangin kung anong dapat ni baby, kung anong dapat nyo sundin, kaya ba ng sikmura nyo na i-stop yung breastfeeding nyo for 2 weeks dahil itong nanay na to na problema talaga. Because deep inside her heart, ayaw niyang mag-quit ng breastfeeding for 2 weeks. Kaya siya nag-message sa akin. So, my advice to her, go back to your doctor or you can call your doctor or maybe message your doctor na when you go back to your doctor, magbabayad din naman kayo eh. So, communicate with your doctor before you even leave that clinic. Okay? Kasi pabalik-balik kayo, panibago na namang bayaran. Or insist na make sure na i-voice out nyo yung mga tanong nyo. Kasi alam ko naman minsan, I've been to clinics diyan sa atin, na minsan talaga yung mga doktor nagmamamadali sa dami-dami ng mga pasyente. Minsan wala ng time sa inyong mag-discuss kung ano man yung mga importanteng bagay na talagang gusto sana niyong malaman. So it's always good to say it, voice out kung ano yung gusto nyo, and what other ways that you can do to make sure you maintain breastfeeding even though you're taking such medication. Now, again, the information I'm giving you are general information. It may not work for you. It may work for you. The best thing you can do is consult your doctor, okay? At least may idea na kayo na anything that you take in, kahit food, kahit drinks, little amount of that would really pass into your mouth. Now, depende sa doses ng medication na ginagamit nyo, depende sa klase ng medication na tinitake nyo, kung talagang contraindicated to breastfeeding. I know for a fact that most antibiotic are compatible with breastfeeding, okay? And that's what we study. And discuss that one with your doctor. And for moms who are taking medication for other complications, ang pinaka-common talaga yung high blood pressure medication na minsan talaga very strict yung mga doktor. So, find that regimen thing, kung paano i-manage yung medication nyo while you're breastfeeding. If the doctor will say pump and dump after for 24 hours or after 14 days, you may have to do that. Because if you abandon this one for 2 weeks, then this one will dry out. And then mas lalo kayong magkakaproblema when times like that. So, thank you again for watching. I hope you learned something from this video. Please don't hesitate to ask more questions from your doctor or from me, because I'm here to just guide you and give you some insights on what to do, okay? Bye for now. Continue to subscribe. More videos to come, and I'll see you next time.